The child that's between 4 and 8 months, their growth, they gain about 1 pound a month. They double their birth weight by about the 8th month. Their length increases by 1/2 inch per month. They begin to develop teeth, and their true eye color is established. In the 4 to 8 month category, their motor development, the baby reaches for objects with both arms simultaneously. The baby transfers objects from one hand to another. They handle, they shake, they pound things, they put everything in their mouth. They sit alone without support. They pull themselves up to a crawling position. They can roll over from front to back and back to front. They might begin scooting backwards. They like to be placed in the standing position, and they pick up objects with a pincer grasp. That's between the finger and the thumb. Their perceptual cognitive development, they turn towards familiar voices and sounds, focus on small objects, and reach for them accurately with either hand. They use their hand and their mouth and their eyes in coordination to explore surroundings. They imitate actions such as pat a cake. They show evidence of depth perception. They tense and they pull back and become fearful of falling. They look over the side of the crib for objects that drop. So if they drop, their pacifier or something over the side, they're looking for it. They search for toys or food that have been partially hidden. They handle and explore things. They pick up inverted objects. If a cup is upside down, they'll pick it up and turn it around. They ignore the second toy or drop a toy in the hand when presented with another. So they might be holding a toy and someone hands them another toy. They drop that one and reach for the other one. They bang things together, and they continue to put everything in their mouth. For speech and language development, they respond to their own name. They imitate some non-speech sounds such as coughing or clicking their tongue or smacking their lips. They produce a range of vowel and consonant sounds, respond to a variation of voice. They express emotions such as anger or pleasure. They talk to their toys, and they babble, and they react to different noises, some that they like and some they don't like the vacuum cleaner or the phone or the dog barking. Their social emotional development, they delight in observing things around them. They begin to develop a sense of self. They respond differently and appropriately to different facial expressions such as frowns and smiles. They remain friendly to strangers. They haven't developed stranger anxiety yet. But at the end of that period, they start to develop stranger anxiety. They laugh out loud. They become upset if a toy or something is taken away from them. They seek attention by moving their body and making noise. And in their daily routine, they adjust to the family's routine. They begin looking at the family's schedule where they might eat 3 or 4 times a day with 6 to 8 ounces. They show interest in feeding by reaching out for their food or their cup. They begin to accept pureed food, and they close their mouth firmly when they are satisfied and don't want to eat something. They like to be free of their clothes. They like to splash in the bath. They like to pull off their own socks and play with buttons and strings and Velcro. They usually have about 1 bowel movement a day. They awaken early in the morning. They begin to give up their late night feeding. They sleep between 11 and 13 hours in a night, and they take 2 to 3 naps a day. They enjoy lying on their back. They kick, they stretch, they put their legs upward, they grasp their feet and try to bring them to their mouth. They look at their own hands, they play with soft squeaky toys, they talk to themselves, they differentiate between people, and they like rhythmic activities. Moving on to the child that is between 8 and 12 months, their anterior fontanelle begins to close. That's the one up here. 4 upper and lower incisors and 2 lower molars begin to appear, and their vision begins to improve a little bit to about 2100. Now normal vision is 20/20, so 2100 doesn't sound very good, but it's better than it was, and it will continue to improve. For their motor skills, they reach with one hand, they manipulate objects, they explore new objects by poking them with their finger, they stack things, they pull themselves up to a standing position, they begin to stand alone, they creep, they walk with adult support. For the perceptual cognitive domain, they show awareness, they respond to hearing tests, they understand some words, follow simple instructions such as wave bye-bye, they reach for toys, They keep putting everything in their mouth. They drop toys intentionally. Remember, they drop it and want to watch you pick it up. They show appropriate use of everyday items, such as pretend to drink or hug a doll. And they begin to show understanding of cause and effect. They search for hidden objects, toys. And in their speech, they babble and they jabber deliberately to initiate social interaction. They shake their head for no and maybe for yes, but definitely no. They respond to looking for their, when their name is called, they respond by looking for the voice. They babble in sentences that are kind of like mama, mama, ba, 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 followed by jargon. They wave bye-bye, they clap, they say dada, mama. In their social emotional stage, they begin to have a fear of strangers. They cling to their parents, resist separating from their familiar adult or caregiver. They want an adult in constant sight. They enjoy being near and included in everyday activities. They enjoy new experiences. They show the need by extending their arms. They want to be held. They begin to exhibit assertiveness by resisting caregivers' requests. So they may kick or scream or throw things or throw themselves on the floor if there's something they don't want to do or don't want to stop doing. They look up and they smile at people who say their name. And they carry out simple directions and requests. And they seem to understand no, yes, come here. In their daily routine, they eat 3 meals and some snacks. They begin to refuse the bottle. They learn to drink from a cup and want to hold it alone. They begin to eat finger foods, and they develop food likes and dislikes. They enjoy their bath. They show interest in pulling off their hats and socks and shoes. They fuss when their diaper's changed. They cooperate somewhat when getting dressed. They have 1 or 2 bowel movements a day. They may remain dry at nap time. They go to bed willingly. They sleep until early morning and may play in their crib for 15 to 20 minutes after waking up. They usually take an afternoon nap, and they enjoy large motor skill activities. They like to place things on their head. They put objects in and out of each other. And they enjoy hiding and standing behind a chair when you say, "Where's the baby?" They show interest in opening and closing cabinets. They hand objects to adults if the adult requests it. And they respond to no by stopping. When we talk about behavior, we refer to it as child guidance. And when we're talking about child guidance for an infant, a baby through 12 months old, we need to make sure that always that it's positive child guidance. It's about reacting to the child and not punishing, but guiding the child to the desired result. So newborns need adults to respond to their cries and love and in a loving and gentle way, and just responding to them. If they're crying, they need something. Not that they need to cry. They need something. So they need adults to respond to them. A baby that's 1 to 4 months old needs to have learned to self-soothe. And so holding a baby, quieting a baby, swaddling a baby, rocking the baby, singing the baby, offering a pacifier, that all helps the baby learn to self-soothe. And then in a baby 4 to 8 months, you can help that baby by maintaining a schedule, eating and sleeping schedule. It helps them. Creating a safe environment, conveying a sense of calm when responding to the baby when they're fussy. And then in 8 to 12 months, introduce the word no, but introduce it gently. Redirect a baby if they're going to something and they don't want them there. Just take that object away or put the baby in a different spot. And give attention when an infant's behaving appropriately.